Hello, welcome to Healthy Kingston, a health promotion and wellness program of the Kingston Board of Health. My name is Janet Wade, and I'm your host. Many in Massachusetts are losing their food assistance. Upward of 80,000 people, 50,000 of which are children, are losing what's called SNAP benefits, or Supplemental Nutritional Assistance Program monies. Two of the major issues are the fact that the federal government has changed its regulations on SNAP benefits. And the second is that there are many people who are reaching out to SNAP operators, benefit program people in Massachusetts, trying to find out if their benefits have been changed, and if so, to what degree. And so these phone people are being inundated with calls, and it's very difficult to get through to them. So it's important that you be persistent and you keep calling back, or you phone tag and have people call back so that you can get in touch with an assistant, and to be vigilant about it. The SNAP number is 508-588-0447. Also, in the meantime, to help you, there are 6 food banks within Kingston and the towns surrounding Kingston that I'd like to make you familiar with. You can also get in touch with South Shore Community Action Council. They have a website, and their number is 508-747-7575. In Plymouth, you can reach out to Christchurch Plymouth Food Pantry on Court Street. You can, on the Plymouth-Kingston line, you can reach out to Plymouth Area Coalition for the Homeless, which is on Bishop's Highway. In Kingston, the Vineyard Church, their program is called Care Works, and St. Joseph's Church also has a food pantry. In Duxbury, the Lion's Share Food Pantry on Summer Street is available, as well as Pilgrim Food Pantry on Washington Street. And in Marshfield, there is a food pantry on Ocean Street. And in Pembroke, the Firehouse Pantry, and Pembroke Soup Connection, which is on School Street. The focus of our program this month is on a grant, Massachusetts Department of Public Health grant that was given to the area, for which it was applied for, and it's called the Public Health Excellence Grant. And it is administered through the Plymouth Public Health Department, but we're going to find out a lot more about it as far as what it's doing for the area and how it is bringing in information and resources to improve public health in not only Kingston, but the surrounding communities. So with that, I'd like to introduce Linda Riordan, who is the coordinator of this grant. And Linda, thank you very much for being here. And I know you have a very busy job, so if you could tell us a little bit about the grant, when it started, how long it's in place, and what its purpose is.
Okay. Well, thank you first off for having Devon and I providing this opportunity to join Healthy Kingston to provide some information about the Southern Plymouth County Public Health Excellence Collaborative. It includes the towns of Carver, Duxbury, Kingston, Plymouth, Plimpton, and Wareham. It started in FY22, and the funding is guaranteed through FY27. At this point in time, we don't know what funding for FY28 will be. 322 of the 351 municipalities in the Commonwealth are part of this Public Health Excellence Collaborative program. So we're one of 56 PHE grantee programs in the state. The funds are essentially used to support the municipalities in meeting the statewide performance standards, to expand service capacity in the communities, and to deliver more equitable local public health services. Some of the initiatives focus on environmental health, disease control and prevention, community outreach, and workforce development. So currently, the staff consists of myself and Devon as the epidemiologist. In the past, we've provided over the last few years a variety of services. We had hired a regional public health nurse who provided nursing services at each of the town's Council on Agings. She provided educational programs, information sessions on a variety of topics. She did blood pressure checks and cholesterol and glucose monitoring. And she also provided MAVEN coverage, which is actually a requirement of the state. Each town is required to have a primary and a secondary MAVEN coverage. And with the exception of Kingston, the other towns' part-time nurses only provide MAVEN coverage. So the town of Kingston's nurse works additional hours and provides other services for the community. We also hired a part-time food inspector to conduct food inspections that need to be done twice a year, primarily in Wareham and Kingston, but as needed in Carver, Plimpton, and Duxbury. We've hired a consultant to conduct the twice-a-year retail tobacco compliance checks for 4 of the 6 communities that are not covered as a part of the Barnstable Tobacco Coalition. And we've also hosted a variety of activities, mental health first training that we've done a couple of times. We've offered it a couple times, vaccination clinic with Big Y, and we recently hosted a community baby shower at the Plymouth Health and Resource Fair, where the communities donated diapers, wipes, formula clothing, toys provided for this event, and additional educational materials were also handed out. And we are currently trying to coordinate with the Plymouth County entomologist to present information on tick safety, because the SSA has purchased tick kits to hand out at these events. We also have plans to host CPR first aid training. I think that Kingston is looking to schedule that sometime soon.
Tremendous. Well, so in a nutshell, these are monies, there was a grant that was written. These are monies from the Massachusetts Department of Public Health to help serve and supplement the services that have been going on in all these different towns. And, offer them more resources, offer them education, supplementation of staff. And this has been going on since 2022. And your board is made up of...
Yes, so our grant committee, or the advisory board, consists of 1 voting member and an alternate from each of the towns. Right. Generally, it's the health agent or director, and in Plymouth, it's a Board of Health member. And I would also like to mention that this public health program is backed by a $26.2 million state and federal funds that are allocated by the Department of Public Health. But as I mentioned, the contract expires in FY27, so we're all wondering what funding will be in FY28. Yes, the funds help to build capacity and increase regional sharing of the public health resources.
Do you see that as something continuing in the future once the grant, if the grant has ended? Have you built in any sustainability to keep some of this going?
At this point in time, ideally, we would have continued staff. We have unsuccessfully tried to rehire the public health nurse position, but due to the limited funding for the grant, we were not successful in hiring. But I might also mention that we are currently contracting with Cape Cod VNA Services to provide nursing services and programs in FY27. So we are very close to having that contract all set and ready to go.
I think that segues over to Devon, Donovan, who is the epidemiologist for the project. And Devon, for those of the viewing audience who don't know what an epidemiologist does, could you please explain that for us?
Certainly, and thank you, Janet, for having me here as
Certainly.
well. I love talking public health. So, an epidemiologist, I always use the river analogy. So if you imagine there's a community of people who are falling into a river, doctors and nurses and other healthcare professionals are saving them from the river, an undeniably important job. Epidemiologists and other public health professionals are typically wondering, why are people falling in the river and how can we prevent future people from falling in the river? So I like to look at disease trends and analysis that are already happening in our communities, as well as new and emerging trends, to see what we can do using our existing infrastructure and expanding the services like Linda mentioned to make Kingston and the other communities we serve a healthier place.
Right. Well, that's a great analogy, the river. So, we Kingston residents are all ears here. Can you, in your research, what have you found as just general findings about the community?
Sure. So Kingston is a great place to live, which I'm sure many residents would love to agree with.
Right.
It has about a population of around 14,000, which is a little bit larger than the average Massachusetts town. I think it's around 10,000. And most of the people who live here, about 20% are children, and 22% are people over 65. So if you were to pull 5 people out of Kingston, one of them will likely be a child and one of them over 65. That's higher than the state average for people over 65, which is common in this area amongst the other towns that Linda and I serve. The one thing that did stand out in these reports is that we noticed that there are higher flu and COVID trends in the winter based on the data that's collected in the Massachusetts Virtual Epidemiological Network, MAVEN, as we said.
Right.
And that data is collected directly from laboratories and healthcare providers. So we get the positive results and we can see those trends happening. Knowing that this is a community of older adults, we found in the report that we should always be aware of how we can start flu prevention early, encouraging vaccine uptake when it's available, as well as keeping people educated how to stay flu safe in the winter.
Right. And as we were talking beforehand, you mentioned that these are significant numbers because these are numbers that are reported to physicians. Physicians know about cases, that there are so many out there that aren't. So, you're getting a minute picture to a degree of what's actually going on. That's probably even more of an issue than we realize.
Precisely, Janet. We always presume we're underreporting a lot of the numbers in MAVEN because not every time someone gets sick, they'll go to the doctor and get a test from a laboratory.
Right.
But I always am on the optimist side that some data is better than none. So having this insight in 2025 alone, more than 60% of the cases in Kingston were related to flu and COVID. So those show us that primarily those are what we're looking for in the wintertime. And another big standout was over a quarter of the cases are diseases carried by ticks, tick-borne illness. So, you don't have to be an epidemiologist to know there are a lot of ticks in this area.
Right.
You can go into your own front yard, backyard. What we encourage, especially as we enter the summer months here, is to dress tick smart, be tick safe. If you can check yourself for ticks, especially when you're in tall, grassy areas where ticks love to live, and to be aware of any risks of ticks in other areas.
In the areas.
Yeah.
Sure. No, absolutely. No, everyone's well aware of that, but there again, it bears repeating every year. Yeah.
Absolutely.
To the point, yes.
Amongst that, in the report, we also took a look at some of the educational measures. So one thing that's really great about Kingston is that there's a higher graduation rate here than compared to the state. So in the study, that the data is provided again from the national level data from the census, as well as the American Community Survey, which happens every year. So we looked at that data amongst other sources and found that 95.8% of Kingston students will graduate high school, which is great. That's higher than the state average, which is around 84%. The one thing that we've discussed as well before is chronic student absenteeism is a little bit higher in Kingston. So absenteeism in this case is defined as missing 15 or more days of school in a single school year. The data that was provided was from the 2022 to 2023 school year. And in that case, it was around, I believe, sorry, let me take that again. I missed that. So the data we looked at was from between 2022 to 2023, where students in Kingston, 1 in 5 were likely to be chronically absent in the school year. And that translates, based on the population, to about 934 students were missed 15 or more days of school in the 2022 to 2023 school year.
What percentage is that of the students?
That was 22%.
Wow. Wow. Have you been able to dig deeper to find out what might be accounting for that?
So since we're talking about the 2022 to 23 school year, my first thought was COVID. We all know COVID affected a lot of the engagement numbers and attendance numbers in these schools. And that is my first thought. My second thought is that perhaps there are other barriers that keep kids from getting to school. We know that anything that you can find in the report I've written, nothing happens in a silo, it all happens across the lifespan. Another big standout factor was the cost of living in Kingston, and that there's a significant number of households, about 34%, where they're spending more than 30% of their income to pay their rent or their mortgage. So this is a cost-burden household. In the context of students, if you have parents who, for example, are spending a significant amount of income on their rent, then they may be working multiple jobs, which makes it difficult to bring the kids to school. So we try to think what other factors of life are preventing kids from getting to school.
Right.
And the report itself is to be a compass and to say this is where we should maybe point our attention. So with that information, could we talk to these community partners in the school and say, what do you notice about kids not getting to school? Why are they not coming? What do they know? Because teachers are seeing them every day. So working together in partnership to address this, I think, is the solution.
Yeah, absolutely, absolutely. Were there any other significant findings?
Amongst the report that I looked at, I think those were the big ones. Again, the big 3 takeaways from my report were cold and flu season are really big. Looking at 15 years of MAVEN data, which is, again, where we get those laboratory results, more than 50% of the cases in Kingston happen in the winter, which is when cold and flu peak. So that was the first big one.
Right.
Second one was related to cost of living, like I just touched upon. Again, don't have to be an epidemiologist to know that it's a tough time for everybody, but to think about how being burdened by costs can prevent you from seeking medical care or other necessary steps, can limit you in other areas. And 3, the chronic absenteeism of students in the schools. Those were the big takeaways. And again, it's supposed to be a compass to point you and to where you can be, but overall, Kingston meets or exceeds a lot of the standards on the state level. It's a very healthy place to be, but it's programs like this where we're always thinking about what we can do a little bit more of to keep us healthy.
Sure. No, excellent points. So, as you were mentioning earlier, you have the data. You know where the issues are. Are you making inroads in working with the community on addressing some of these things, for example, the schools?
Absolutely. So because we work with 6 towns, I'm always trying to build partnership where we can. And something that affects Kingston usually isn't just affecting Kingston.
Sure.
So to collaborate with some of the great community partners you mentioned at the beginning of the show, to get to know them and other resources that are available, as well as making the report available on our website that I've done, and putting it in the hands of health departments, health directors, and those community actors to keep them informed, because information is power.
Absolutely, absolutely. Well, what a tremendous initiative. What a boost to the public health system in our communities. And as you say, it's a collaborative.
Absolutely.
Working in unison. The chick can jump over to Halifax or Pembroke. I mean, it's important that we work in unison with each other, to address all the issues. And, to have representation. You're not coming in and telling people what to do. You are of the community. You're getting the community involved, the major players, particularly the public health directors, agents, staff, to be part of this process, and so you can all work collaboratively. It's wonderful.
Yeah,
I mean, you're
it's
definitely
great
making
work.
an
And
impact.
I might want to mention, too, that one of Devon's first projects when she started, 2 years ago, was to do a health profile for each of the 6 towns of the collaborative. So every town has a health profile, and they can all be found on the website. Yes.
Terrific. That's wonderful to hear. So we need a healthy Pembroke, and we need a healthy Halifax, and a healthy Duxbury, and all the rest of it. So, but good for Kingston.
Definitely.
That's great.
It's a
You've
great
done
place
so
to
well.
live.
I'm
And
happy to be
something-
living here.
Yeah. Yeah, that should be in South
Yeah.
Shore Magazine. One of the, wasn't it? Kingston's one of the desirable towns to live in. I think I had read that recently.
One of the other measures was that people who move here like to stay here. So there's not a lot of people moving out. So it shows that people like living in Kingston, which is a great sign because community is such a key point of a health, right? Having people to turn to and those resources to look for. So it's a great place to live. And like I said, we're always just looking for that little extra push.
Yeah, yeah. Wonderful. Gee, you two should work on marketing for the community. The town administrator needs to market. Public relations. Well, again, thank you both very much for being here. And so be on the lookout for the impact of this tremendous grant, Public Health Excellence Grant, in our community and the surrounding communities and all the services that it's offering. And do keep in mind that I'm sure we're all well aware in our financial state at the moment that food inequity and food deserts are a very real reality in our state and across the nation. So be persistent if you're calling in about SNAP benefits. Do know that WIC benefits have not been affected and that you do have resources. South Shore Community Action Council, their website and also by phone can lead you to these different food pantries that are in the area if you don't know about them yourselves. So with that, stay happy, stay healthy. Thank you for tuning in.